Welcome. Today we're delving into neurofibromatosis, a complex and often misunderstood group of genetic disorders that primarily affect the nervous system. We'll explore its origins, how it manifests, and what can be done to manage it. Neurofibromatosis isn't caused by a virus or infection. It's a genetic condition, meaning it stems from changes or mutations in a person's genes. These mutations can either be inherited from a parent or occur spontaneously, meaning they arise randomly in a person's own genetic makeup. There are a few different types of neurofibromatosis, and each is associated with a different gene. Now, let's discuss how these mutated genes actually lead to the symptoms of neurofibromatosis. In essence, the genes involved play crucial roles in cell growth and development. When these genes are mutated, they can disrupt the normal process of cell division and differentiation, leading to the growth of tumors. These tumors, called neurofibromas, develop along nerves throughout the body. Specifically, for neurofibromatosis type 1, the mutated NF1 gene leads to a deficiency in neurofibromin, a protein that normally regulates cell growth. In neurofibromatosis type 2, the mutated NF2 gene impacts myelin, a protein involved in maintaining cell shape and suppressing tumor formation. The less common schwannomatosis usually involves mutations in SMENRCB1 or LZTR1, causing schwannomas to grow on nerve sheaths. Neurofibromatosis affects individuals worldwide, across all ethnicities and genders. Neurofibromatosis type 1, or NF1, is the most common form, affecting about 1 in 3,000 to 4,000 births. Neurofibromatosis type 2, or NF2, is less common, occurring in approximately 1 in 25,000 to 40,000 births. Schwannomatosis is the rarest, with estimates ranging from 1 in 40,000 to 1 in 100,000 people. The signs and symptoms of neurofibromatosis can vary significantly from person to person, even within the same family. In NF1, common signs include late spots, which are flat, light brown birthmarks, neurofibromas, benign tumors that grow on nerves, lich nodules, tiny bumps on the iris of the eye, and skeletal abnormalities. NF2 primarily involves tumors on the 8th cranial nerve, leading to hearing loss, tinnitus, and balance problems. Individuals with NF2 can also develop other tumors in the brain and spinal cord. Schwannomatosis is characterized by intense pain, often localized, due to the growth of schwannomas. Diagnosing neurofibromatosis usually involves a thorough physical examination, including skin and eye examinations, and a review of the individual's medical history. Genetic testing can confirm the diagnosis, especially in cases where the clinical signs are not clear-cut. Imaging studies, such as MRI and CT scans, are used to detect and monitor tumors in the brain, spinal cord, and other parts of the body. Specific diagnostic criteria have been established for each type of neurofibromatosis. There are 3 main types of neurofibromatosis: neurofibromatosis type 1 and F1, neurofibromatosis type 2 and F2, and schwannomatosis. Each type is caused by mutations in a different gene and has distinct clinical features. Understanding the specific type of neurofibromatosis is crucial for tailoring treatment and management strategies. Currently, there is no cure for neurofibromatosis. Treatment focuses on managing the symptoms and complications. This may involve surgery to remove tumors, medications to manage pain or other symptoms, and therapies to improve hearing, balance, or vision. Regular monitoring is essential to detect and address any new or growing tumors. A multidisciplinary team of healthcare professionals, including neurologists, surgeons, ophthalmologists, and geneticists, is typically involved in the care of individuals with neurofibromatosis. Because neurofibromatosis is a genetic disorder, there's no way to prevent it from occurring in the first place. However, genetic counseling can be helpful for individuals with a family history of neurofibromatosis who are considering having children. Genetic testing can also be performed during pregnancy to determine if the fetus has inherited the gene mutation. The prognosis for individuals with neurofibromatosis varies depending on the type and severity of the condition. Some people may experience only mild symptoms, while others may develop more serious complications, such as tumors that compress nerves or cause significant pain. Recent research is focused on developing new therapies that target the underlying genetic defects and prevent tumor growth. Clinical trials are ongoing to evaluate the safety and efficacy of these new treatments, offering hope for improved outcomes in the future.